Hi, I'm Dr. Rod Gleave and would like to share with you some information about your options for improving your smile. There's never been a better time in the history of dentistry for cosmetic dental options. The techniques, materials, procedures are at a point where we can create teeth that rival the most aesthetic natural teeth. While the majority of the patients I see who want to enhance their smile will do so with porcelain veneers, there are several other more conservative options. I am very aware that no two people are the same and work hard at trying to understand which treatment is best suited for a particular individual. Even if doing veneers, the size, shape, translucency must match the skin complexion, personality, and face of the individual. Let me address what your options are if you're not happy with your smile. Porcelain veneers will give you the most dramatic result in the shortest amount of time. If you have been hesitant to smile because you don't like the appearance of your front teeth, veneers are a great option. We can dramatically change the appearance of someone's smile, face, and personality with porcelain veneers. They allow us the freedom to build in the perfect teeth. We're able to correct dark, crooked, misshaped teeth with nearly instant results. If you want a complete smile makeover, 8 to 10 teeth are treated. But there are many cases we can achieve great results with 1, 2, or 4 veneers. Doing veneers is a mainstay in our office and not something we just do once in a while. I have great passion for every case we treat. Doreen, it's good to meet with you again. We took the photos and we got our models last time. I've got some new information I just want to go over with you today.
Great.
So specifically, I want to talk about your smile and what we've decided may be a good course of action to enhance that. We've got an old crown in here that doesn't quite match up right. You've got some unevenness here. Someone's tried to do some composite bonding in the past. It's worn. You know, as far as changing the color of your teeth significantly, the thing that we've come up with to help us the best is porcelain veneers. But with that porcelain and with bonding, which we have cements to then bond that veneer to your enamel, we can create a very strong result. And what we're looking for is something that's going to change the shape, the size slightly, and more than in your case, the color of the teeth, and give us that. It's almost like countertops that are veneered in Formica. What we're doing in porcelain, we're customizing it, and it's the same result, a very thin facing of veneer that's going to go directly over the tooth.
I'm driving to Dr. Gleave. We have the temporaries in now, and so we're going to talk about the shape and dental. I've had an awful lot of dental work in my life, and my teeth have always been a source of pain for me. And I'm not afraid of the dentist necessarily, as long as they give me that gas stuff so that I feel happy. But I think that the experience I've had with Dr. Gleave has been great. His staff is so awesome. They're like my friends now, and I feel really happy to be able to associate with them, and that helps my anxiety level.
So if we look at the photo of your smile, these are the temporaries that we placed last week. There's a couple things that right off kind of catch my eye. I like the ovalness that we've created, certainly compared to, say, when we had your first smile. So when I look at your initial smile, where you're at here, one of the first things I notice is you're smiling more. You're showing a little bit more teeth now. Now, because we did real conservative preparation, real minor preparation, didn't remove much tooth structure. When we put the provisional smile in, it bleeds through a little bit. And so that's why we're showing just a little extra darkness in through here, and that's just due from that thinness of this temporary material. And so don't be alarmed when we do the porcelain. We're able to mask that over with our cements. In this trials run, there's no cement in there. So this is the shade we looked at a little bit briefly last time. Usually when we're doing veneer cases, we're working off our lighter shades. This is one's identified as a bleaching shade. We've got kind of a whole spectrum of colors we work with. So, but for the most part, we're not going to do our veneers in these darker colors. I mean, no one goes through this effort to put on dark teeth. Sometimes we do. Some people want a natural look.
Okay, I like
And when
that.
you contrast it with your lower teeth, you can see quite a difference.
I don't even want to look at my lower teeth.
Quite a difference. So we're changing quite significantly here. If we're shading a single tooth or in the posterior, we're trying to match things up naturally. When someone goes through and does an entire smile, we're pretty much going to focus in on the lighter shades. These are identified as bleaching shades. And so in this spectrum of colors, we've got 4 options. And even though most people I show these to, they say they all look the same, they're not. They're very different. We don't want to get things looking too unnatural, too phony looking, all right? We want to make it look nice and healthy looking. That's what we're looking for. But everyone has a little different opinion.
I'm feeling really numb right now, and I'm sure I look so beautiful. And I've got, but the doctor took great care of me, and I felt comfortable, and these teeth feel secure, so I'm anxious to see how it'll feel in the next couple of days.
I look forward to seeing you again and helping you restore your teeth and smile to full health, function, and aesthetics.